Hey, welcome back everybody. In today's video, we're going to go over what is it like working in the ICU. In my last video, I talked about what is it like working in the ER. If you didn't see that one yet, make sure after this video you go back and watch that. It also has some great content and good information. And also subscribe to my channel because it's nice and it would make me happy. All right, so working in the ICU. The ICU is a very unique creature. It is very controlled, very organized and structured. Usually everything is scheduled, you know what to expect. There is a ton of charting. You are charting like all day, like Q1, Q4, like you're gonna be charting a lot, and you're gonna have to get used to charting everything that you do. Make sure you're covering your butt and documenting everything that you do, because these are really sick patients. And when I think of the ICU, the word that comes to mind is management. You are going to have to learn how to manage your time, manage the care that these patients are receiving, and managing patients' families, kind of managing their expectations, lots of communication, explaining what's going on, what we're doing with the patient, why they're presenting in these types of ways. And honestly, the ICU can be a pretty sad place to work at, because these patients are always really sick, and so that doesn't always mean great outcomes. Like even if they survive, sometimes that means that they are going to have to go live in a long-term care facility, and families are often put in positions where they have to make really hard decisions in ICU. So you have to be able to conduct yourself professionally, be honest, and be there for those families who are going through these tremendously difficult times with their loved ones. So again, when you get to work, you're going to get report for your 2 patients. Sometimes you have 3, but it depends on where you work. These patients are so sick, it's ideal if you just have the 2. And in report, the night nurse or the day nurse, whoever you're taking over for, is going to start going through their history. Why are they there? What's their code status? You're going to go through all the different systems: neuro, cardiovascular, respiratory, GI, GU. These patients are oftentimes on a ventilator. They usually have like central lines and arterial lines, and you're going to have to learn how to manage all of their pumps and drips and be able to titrate drugs. The ICU is where it's going to be slower, but it's going to be way more in depth. You're going to have to manage these patients' care meticulously, and you're measuring input and output, and they're going to be on some pretty crazy drugs like vasopressors and paralytics, sedatives. You're going to have to know what all those orders are and the parameters. There's going to be a lot of specialized equipment, things that you wouldn't see on the floor, depending on what kind of ICU you work at. If it's cardiac or neuro or trauma, you're going to have to learn how to manage a lot of equipment that you maybe aren't used to. Like they might have a PCA pump, they might have intraventricular drain or a bolt in their head, and you have to manage their intracranial pressures. You may be draining spinal fluid. There is going to be a lot of specialized equipment that you'll learn how to use, but that's also why it's awesome working in the ICU. You're going to learn how to manage all kinds of drugs and keep them hemodynamically stable, and you're going to know the ins and outs of how to manage a Foley and Lasix, and know the blood work, know how to replace electrolytes. Like the ICU is where you go once you are ready to learn high acuity and really expand your knowledge base about physiology and pharmaceutical drugs and everything. Like the wealth of knowledge that you're going to gain in the ICU is immense. Also, working in the ICU, you're going to be cleaning people. Like I feel like half of your job in the ICU is cleaning up poop. Like they're pooping constantly. You're trying to make them poop. Enemas, suppositories, Miralax. But it's worth it because you get to know those patients and their families, and You get to learn so much more about nursing care and medicine, and just putting all the different systems together. Like, how is the cardiac system reacting with what's going on in their respiratory? You know, you're going to learn how to use ventilators. There's just so much to manage, so much to learn. You could work there for years and still learn at least something new every single day. So if there's anything you want me to talk about more specifically when it comes to the ICU, make sure you drop it in the comment section below. I'd love to expand on things that you guys are curious about. And thank you for taking the time to watch this. Definitely work in the ICU. I recommend it. You'll never stop learning.